Good afternoon, everyone. My name is Berhan Hagos, and I am currently a junior in Trinity College majoring in International Comparative Studies and pursuing the Global Health Certificate. So to give you a very brief personal background, I was born in Addis Ababa, Ethiopia, and spent much of my early childhood there. And in the summer of 2011, I had the opportunity of going back for the first time and working with the Ethiopian Public Health Association as an intern, and as well as with the Blue Nile Children's Organization. And those two experiences really inspired this project, Perceptions and Impact of HIV-Related Stigma in Addis Ababa, Ethiopia. So to give you a brief background, HIV and AIDS is a big problem, as a big issue in sub-Saharan Africa, and Ethiopia is not an exception. As of 2007, there are currently 980,000 people living with HIV. And stigma, we know, is a big issue when it comes to, it impedes access to universal treatment, national programs to address HIV and AIDS that are implemented nationally, as well as HIV testing. So my project focused on 3 questions. What were the general levels of HIV and AIDS knowledge in caregivers, community leaders, and children, as well as how caregivers made the decision to get themselves tested, as well as their children tested. And lastly, how employment could be affected by the potential stigma in this area. So to kind of work on this project, I had an incredible community partner, Stand for Vulnerable organization, which has a few branches all over Ethiopia. So I worked primarily in Asko, Burayo, and Tekla Haymanot, which are all regions that are of the same socioeconomic status. So my participants I had 60 participants, and they were roughly from the same background. So to give you just a sampling, one of the questions we asked on the survey was the names of people with HIV should be made public so others can avoid them. And so we asked this question after asking questions about their general level of HIV and AIDS awareness to see if that could potentially impact how they would respond to these questions. And participants either agreed or disagreed to this question. And so in our caregivers and community leaders, we found about 57% would agree with this question, with this statement. And with children, we found that 53% agreed with the statement. So there's a difference in the likelihood of these separate communities or age groups to stigmatize, which is really important to note because Ethiopia has an incredibly young population. It has about 80 million people, and of those 80 million people, about 40 million are under the age of 18. So in order to address prevention, like for programs for stigma prevention, I feel it's very important to target persons under the age of 18 because they do make up such a large population. Also, so for the deliverables of this project, the main purpose was to create a report from my community partner, Stand for Vulnerable organization, to have, so they could have material to disperse to their child development programs, which they have most extensively in the Burayo region, so that their instructors and educators can have a better background of the level of information that the children that they're teaching do have about HIV and how they can specifically address issues of stigma because it's not something that's inherently addressed in the current curriculum. So in moving forward, what I would have liked to do, what I would like to do in the future is to really look at what kind of curriculums schools have. And so I did some of my interviews in 2 elementary schools that had children all the way to the 8th grade. And to just see how implementing stigma awareness programs could potentially change how children were to interact with each other and to prevent to prevent people who are HIV positive from facing some of the negative impacts of having a disease that is stigmatized against. So lastly, I would like to thank my mentor, Dr. Samir Arieli, who supported me extensively during this project, as well as the Duke Global Health Institute and the Paul Farmer Global Health Fund for giving me this opportunity. Thank you.
About 5 Describe the picture.
So this is in Burayo, which is where SBO has one of basically their biggest child development program. And these are mothers of some of the children in that program. And they have a self-help group where they basically they self-generate income. So they make these beads. They make jewelry out of paper beads. It's a really fairly intricate process, actually. I tried to do it and I wasn't very good. But this is them at work.
What challenges did you run into talking to young people about such
That's a great question. I speak Amharic, so that was a great asset to have. So I could have very direct communication. But in working with people that were very close in age with me, it was very difficult to kind of establish that relationship of to make the setting very serious, so I could get information that wasn't, because I had the first few interviews I did with kids, especially between the ages of 15 and 18, I was having a hard time getting very serious responses. So there was a lot of joking and kind of establishing that environment in which I could get the valid responses was a great challenge. Yeah.
Did you see a lot of differences between your understanding of HIV when you were growing up there and the perceptions now towards HIV and stigma?
So I was born there and I lived there until I was 6. So the level of awareness I had was probably, what a lot of parents do tell their children is don't pick up sharp objects. If somebody's bleeding, don't come in contact with the blood. And I definitely remember my mom telling me, you can't pick up needles or razors or things like that. And I got a lot of those same responses from the kids between the ages of 6 and 12 who were into it.
I have a question. Are there any plans to continue this project beyond what you've already done?
I would love to go back another summer. This would be, if I went back, it would be my 3rd summer in Ethiopia, and I think I've been working with the Blue Nile's Children's Organization now for 2 years, so I'd really like to continue this project, and actually what I mentioned as what I would like to do moving forward of looking at what the curriculums are like in schools, that's ideally what I'd like to do in the future. Yeah?
So the question that you asked about whether or not you think one's status should be disclosed is an interesting one because it raises some ethical issues. One thing that we think about a lot in doing interviews is whether when we ask a question of someone or of a group, if whether or not they could interpret the question in a particular way.
Yeah.
So you could see someone saying, if you ask the question, do you think that status should be disclosed? They could interpret it as, I wonder if this is someone who does think status should be disclosed. And that could then raise other issues. So how in your work did you ask questions in a way that you made certain that they appeared extremely neutral in terms of your point of view, just as a lesson to other people?
Yeah, so that's a very good question, and something that I had a lot of trouble with, making sure that they didn't have any perceptions of what I would like the responses to be like. So I tried to be so I asked the questions. So some people would say yeah, agree and disagree. They'd be like, doesn't matter, and so I tried to make sure that in terms of my facial expressions, my posture, and my reaction to every single question was just neutral. I think that's one of the best ways, just to make sure that every question you ask, you don't, whether they say yes or no, there isn't any reaction from you, because I know I did some practice interviews that my community organization set up for me, and I know that sometimes a little nod of the head or something that could trigger or change somebody's response to you. And I think making sure that your body language is very much neutral is one of the best ways for me anyway, I found to kind of keep that from being an issue. Yeah.
Any other questions? Okay, good. Thank you.
Thank
very much.
you.